provider standpoint, they just see the patient. And I think if you ever talk to a physician, an APP, that is all anything you can do that is all they do, you are going to win. I mean, so there's a lot on the back end. So, Rob talked about, we now have our call center does the intake, they get them ready. But when it gets to the provider, so when I do an eVisit, I just get on and I see the patient. And that is what you want from a provider standpoint. Anytime there is more crap that you have to do, it's going to be a real dissatisfier. There's so much paperwork and there's so much jumping through the hoop. So I'm speaking now as a clinician, I do still see patients. I do just log on and see the patient. And I do think that's been something that's been really a satisfier for sure from the provider standpoint. Again, that other stuff exists, but anything that you can do in a workflow that makes life better for a provider is a win. Because there's DME and there's prescriptions and there's labs and so just if you add more to a workflow, they're going to just be out from the beginning. So that is something that has been a win on that side.
Could you take maybe 30 seconds or so and just tell us, when you say they just see the provider, like, what does that mean? They're in their EMR instance and then the patient pops up. Like what happens?
Well, that's what happens for me. And so I have my MA that works with me. And so when I have a virtual visit, I mean, the patient logs in, they do their pre-registration, the MA, works. But when I am in there, I hit my connect button and the patient pops up and they are there. And I have that and my Epic, and I am doing it all right there in the screen. So it is very user friendly. I see them and then they go away and I'm done. So and then again, on the back end, now I haven't had to do much translation, but if I needed to bring in a translator, I can bring that in, so all that stuff is right there in the screen. So it is very, very provider friendly.
Rob, how'd you pull that off?
I think the biggest piece of that, it's two things. One is the integration with Epic. What we have a single sign-on the chart review part within Epic. So the MA and the provider both join from a click of a button within Epic, and it signs them in and they're into eVisit. So when that MA and the provider join, they drop right into the waiting room. They click on the little blue icon that says join visit and they do their job. To get there, other than the Epic integration, I had to learn what everyone's roles were. So I had to find out, what do our PSRs do? What are our MAs doing? What's the provider's expectation, really? We know what the provider does. They do their job, but what's their expectation? And wanted to replicate what we were doing in an in-person setting. Along that process, we were also able to eliminate a lot of waste within our in-person process because we did some discovery. So it was a good thing on that side of things, but we're essentially able to replicate that in-person process. We just are doing it virtually. So it made it really easy for the MA and the provider to understand. And it was actually kind of funny because they were often putting more thought into it than they needed to, because they're like, well, what do I need to do? Just do what you normally do. Just it's your job. Like, you do it every single day to 20 patients a day. Let's just do it in the virtual setting as well. And so getting them to stop overthinking was probably the most challenging part with that. It's literally just, you click on the button when you see the status change in Epic and you see your patient. But it took a lot of discovery on the back end and a lot of current state evaluation and a lot of multidisciplinary cooperation and collaboration.
Yeah, one of the things that, it's interesting you say that. One of the things that I observed as being maybe a little bit outside of your project team, but able to check in with folks along the way, is that your kind of streamlining of your virtual care program created opportunities for your organization to say, we do it like this over at this clinic, and we do it like that over at that clinic. We actually have an opportunity to bring those things together for the purpose of driving maybe a more unified workflow or more efficient workflow. So kind of an unexpected win from when we embarked on the process of implementing.